Thank you so much for joining us this Friday afternoon for our end-of-week press conference. Today, Mayor Demings will discuss testing sites. He will also talk about the work of the strike teams and the ongoing CARES funding for individual families, and he has other information as well. With us today from the Florida Department of Health in Orange County is Alvina Chu, the Epidemiology Program Manager, with details on antigen testing and our quantitative data from the state. We will begin the press conference with Mayor Demings. Mayor?
All right. Thank you, Dr. Williamson. Thank you to all of you for being here. Hopefully you're having a great week, and hopefully you'll have a great weekend as well. Just a few minutes ago, we concluded our very first Orange County Citizen Safety Task Force we had at the Magic Gym out at Barnett Park. We really had great input from our citizens here within Orange County about their desire to make our community safer from violent crime. So we look forward to the work there. It will continue for the next 120 days or so, and then thereafter. We are looking forward to having a detailed plan of action that will look holistically at dealing with reducing gun violence here within our community. Okay, let me just transition and now talk more about the COVID-19 pandemic. We now have over 48,000 cases within Orange County, so that number is still somewhat disturbing to me, but that's an increase since yesterday of 334 cases. I remember back in early March, April, it took us weeks to have 330 cases. Now we're having 330 cases in one day. Since our briefing on Monday, we have experienced an increase of 1,336 cases, 1,300 cases in a week. 576 Orange County residents have died as a result of the coronavirus based upon the data provided through the state's dashboard. That is an increase of 15 reported deaths since our last briefing on Monday. Dr. Pino will share more details about those deaths, and our hearts and prayers always go out to those families who have lost a loved one. Our 2-week positivity average has risen since Monday. Monday, we reported a positivity rate of 5.4%. Now it is 6%. I want to let our residents also know that the state of Florida has informed our emergency management group that the COVID-19 dashboard that they were providing that was outwardly facing will not be updated in the late morning hours as it had been done for months. Rather, it will be updated during the evening hours. Why the state made that decision, I'm not sure. One of the major goals that we have in our community is to ensure that free testing continues, and I will tell you that our Orange County Health Services has been working in addition to our private partners, our local hospitals and walk-in clinics, as well as the state site at the Orange County Convention Center to ensure that we are providing testing here within our community. But our health services is managed by Dr. Yolanda Martinez, who is here today. And I want to give some kudos to her staff because in addition to everything that the state and the other entities are doing, they've had to kind of step up to the plate and move around the county geographically to make certain that we provide free testing. They've been doing that now for over 100 days, and they produce great results. On Monday, November the 9th, on Monday, November the 9th, Orange County Health Services will transition to offer both PCR, which is the molecular testing, as well as the rapid antigen testing. So the antigen testing is when you can get your results back within just a matter of 20 minutes or so. We're going to be doing that at our testing locations. Next week we'll be at Barnett Park between the hours of 9 a.m. and 5 p.m. And if you have any questions about any of the specifics there, Dr. Martinez is here. For whatever reason, there are citizens in our community who are highly motivated to get tested when they can get their results back quickly, as opposed to waiting the traditional 48 hours or so. Our research has shown that Barnett Park is a central location in the county, and we have seen residents travel from throughout the county whenever we've done testing at Barnett Park. They're near the Central Florida Fairgrounds. We have seen increased numbers of testing coming from throughout the county. So we have chosen that location next week to provide the regular PCR testing as well as, the rapid testing. You can get information about the testing by going to our website at ocfl.net/testing. Our testing webpage will have additional details on the differences between the PCR and the rapid test. I want to give you an update about the CARES Act funding that we are providing to provide crisis assistance to individuals and families. That program continues to go well. This is where we provide $1,000 to households here within Orange County. Since the portal opened in October, we have reviewed nearly 15,000 applications and have sent nearly 7,000 approvals to the Comptroller's Office for payment. We want applicants to know that we are reviewing on average now about 1,200 applications per day, and that will continue for the foreseeable future. You initially get a confirmation that your application has been received, and sometimes it may take 2 to 3 weeks, however, before you get the actual payment in hand. We do encourage people to apply. Remember that you have to be an Orange County resident, and if you have received, or anyone in your specific household has received the $1,000 at that address, then you would be disqualified for this particular round of assistance. Our strike teams have now visited over 4,500 different county businesses, assisting them with workplace guidance and procedures. The first-time compliance rate is about 87%. We have gone back, re-inspected 549 different businesses with a compliance rate of about 81%. As we approach the holiday season, we have about $5 million in CARES Act funding that we are making available to the arts community. I want to announce a program that we have underway now. It's called Arts in Public Parks Initiative, the Arts in Public Parks Initiative. The idea really is quite simple. We want to create socially distant spaces in 6 of our Orange County parks to allow arts and culture community members a chance to perform during the pandemic. The 6 park arts groups can use these parks: West Orange Park in Winter Garden, Claricona Horse Park in Apopka, Cypress Grove Park, Meadowwoods Park, Fort Christmas Park, and Barnett Park. The maximum capacity for each park is about 700 participants, with the exception of the Claricona Horse Park that will have a capacity of 400. What happens here is these arts groups can rent the parks, and we will provide the stage, the tents, the chairs, and the restroom facilities and other equipment through our CARES Act funding. Then the arts groups have the opportunity to both perform and charge a small fee for admittance into these programs, again, to try to get our arts group back on track. Interested organizations should contact Alicia Baxter, who is the program manager for this, at 407-836-6205. Again, her name is Alicia Baxter at 407-836-6205. Our Parks and Recreation Manager, Mr. Matt Sudemeyer, is here. If you have specific questions, we'll have him respond to those specific questions. All right, thank you, and I'm going to turn it over at this time to Ms. Alvina Shute. Are you going to start off, and then we have Dr. Pino in the audience, and he'll come up and bring up the real.
I brought my own Spanish translator today.
Okay.
Thank you. As Mayor Demings had mentioned, we have seen 48,322 positive cases as of today, and thankfully a 94% recovery rate. The age range for our cases are 0 to 110, with the median age of 36 years. And I just wanted to point out that, as it has been over the last several weeks, the newest cases are occurring in the age range of 15 to 24-year-olds. Unfortunately, since Monday, we've had 15 COVID-19 related deaths reported to us. We send our thoughts and prayers to the family and friends. We have 9 additional deaths under our 3rd level review, so there's 9 additional pending. The age range of these persons who have passed is 35 to 94 years old, 7 male, 8 female. The ethnicity is 3 Hispanic, 11 non-Hispanic, 1 unknown. Race is 1 Asian, 4 black, 1 other, and 9 white. 13 have known underlying health conditions, 2 have unknown underlying health conditions. And I wanted to mention, the deaths are occurring in about 47% in long-term care facilities. I wanted to bring up that these are the persons who are most at risk for severe conditions and for death. And so to help prevent our loved ones who are in these at-risk age groups, I wanted to let you know about our upcoming 2 flu events where we'll be giving vaccinations for free. On this Saturday, November 7th at Jones High School at 801 Rio Grande Avenue in Orlando. And then also the Saturday after that, on November 14th, at the Colonial Promenade Mall at 4308 East Colonial Drive. So for both days, these events start at 9 a.m. The event is free for everyone 6 months and older. No appointments are needed. These are first come, first served, and while supplies last. And so get there early, and you might be aware that there's a possibility of long lines, because we are encouraging everyone in our communities to protect our loved ones during this flu season and respiratory virus season, which includes COVID, to at least protect yourself against this good vaccine, with this good vaccine. As Mayor Demings mentioned, Orange County will be providing tests throughout the county, and specifically at Barnett Park. So I wanted to briefly talk about the different types of tests that the FDA has approved for use and for diagnostic purposes. And so the 3 basic types of tests are molecular, antigen, and antibody, and they tell you different types of things. And so previously I'd mentioned all the data that we present, we should interpret these results in a context. The gold standard is the molecular test, which is PCR, polymerase chain reaction, which detects the genetic material of the virus itself. And this can diagnose a recent or current infection, and it's very sensitive and very specific. And so this is considered our gold standard. What's commonly known as a rapid test is the rapid antigen test, which is best used when a person has a current infection, and it's the reliability of the results depends on the context and whether or not these tests need to be confirmed with the gold standard PCR test or another molecular test depends on your context. And so a rapid antigen test, rapid is relative, it's faster or short time, and it's relative to the PCR or other diagnostic tests. And so I don't want you to think it's a rushed test or necessarily an unreliable test, but it should be interpreted within a certain context. So it's best used when persons are sick, feeling symptoms, especially if you have a known exposure to a lab-confirmed positive case in the context of an outbreak, or in an area where there is high incidence or a lot of new cases that are occurring. So if there's a lot of virus circulating in your community, a rapid test may be a good use. An antibody test detects when your immune system has produced antibodies to protect yourself and after an infection. So an antibody test does not determine whether or not you are currently infected. So there can be rapid molecular tests, rapid antigen tests, and also rapid antibody or serology tests. And I just wanted to bring that up. But the most common terminology for rapids is for the rapid antigen, which I believe is what is being offered in addition to potentially the PCR as confirmation by Orange County government. Thank you. I'll turn it over to Mayor Demings now. Thank you.
All right. I'm just watching our American Sign Language interpreters. They're doing a fantastic job to keep up with all of that technical language that Ms. Shu was using there. So thank you all. Dr. Pino, did you have anything you wanted to add, sir? Okay. All right. Then we'll open it up for any questions. If there's any Spanish-speaking media that's here that has questions, we have Dr. Pino, and if they're for me, Ms. Ilia Torres is here. We also have Mr. Scott Howard from the Orange County Public Schools, if there are any questions about the school district. And lastly, we have Dr. Yolanda Martinez from Orange County Health Services, if there's any questions about what we'll be doing next week at Barnett Park. She's here. She's fluent in Spanish as well. So I just share that with all of you at this point. Okay, questions?
Buenas tardes, Edgar Carrillo de Telemundo. Mi pregunta para el alcalde Demings. Ayer vimos en el centro de la ciudad, en el downtown, algunas protestas con respecto al resultado de las elecciones. Quisiera saber la posición, la perspectiva y si tiene alguna preparación para brindar seguridad en vista de que las protestas podrían continuar en los próximos días. Gracias.
Downtown about the results of the elections. The question will be, what is your position, your perspective, and if there are any preparations in anticipation of some other larger protests?
Thank you for the question. I believe much of what we're seeing here in our community related to any demonstrations surrounding the counting of the votes is really related to what is happening in some other places and not what is happening here.
Jurisdicción en cuanto a las demostraciones acerca del conteo de votos no es exclusivo de nuestra área, sino que son manifestaciones que están pasando en otras áreas del país.
The Supervisor of Elections, Bill Cowles, has assured me that the processes that they have in place here to ensure an accurate count is occurring flawlessly.
El supervisor de las elecciones le aseguró al alcalde de que el proceso de conteo que ocurrió acá en nuestro condado ha transcurrido sin ningún contratiempo.
And law enforcement has reported that they have not seen any unrest associated with the voting processes that have occurred here.
Las agencias del orden público aseguran al alcalde que no han visto ninguna insurgencia o problemas en nuestra área.
Okay, questions?
Lauren Seabrook, Channel 9. My question's for Alvina. Just a couple of small follow-ups to two of the stats you gave, and then I have a question about today being the 6th day after Halloween, and if you think some of this increase that we've seen yesterday and today statewide could be in regards to that time frame. The two follow-ups were, you mentioned 94% recovery rate, which is lower recovery rate than we've seen for a while. I thought it was more like 96, 97%. And then I think you said a 35-year-old death, if you could provide any more information about that.
So I can't provide any additional information about the 35-year-old death. The recovery rate is calculated by, you take all the persons who are currently infected over the total number of COVID cases. And so it's potentially persons have not yet recovered. And so and it's been not that long of a time since we last reported the recovery rate. And so that goes. It's 94%, which is great. And, the death rate or the proportion still remains about the same and is low, as does the hospitalization rate currently remains approximately stable. And so as far as the cases that are occurring, which are potentially relate to the increase, that's a possibility. So I think we know that as more people are out and about in the community, and we know that over the last several weeks, these cases, the newest cases, have been occurring in persons who are young, so 15 to 24, and those are potentially the persons who are out and about circulating the community. So that is possibly the reason for this increase. Is it specifically tied to Halloween? Maybe not necessarily. We've been on an increase over the last several weeks. If you can see the general trends, it fluctuates daily as far as the number of cases that are reported out, but the general trend overall has been a slow increase as we've sort of relaxed with our pandemic precautions and people are less apt to practice what we've been hoping would help us tamp down the pandemic, which is the wearing of the masks, the social distancing, and the hand washing, good hand washing.
Steve Hudak from the Sentinel. This is for anybody here, actually. Mayor, I'm interested about what you're hearing from other counties on the conference calls. Are they concerned about the rising cases in their region? And this is also for Dr. Pino and Alvina, which is the increase in cases that we're seeing. Can we keep up with contact tracing with this? And, you know, we've seen other countries like England is going through a new spike. So is that what we're headed for?
I think that we'll start with you. Ladies first.
So can we keep up? So we have been focused since the beginning of the pandemic on trying to push our priorities towards those places where we can have the most effect. And so going for persons who are in congregate settings and persons who are at high risk for severe complications and potentially death. And so we will continue to focus the contact tracing efforts on protecting those who are the most vulnerable.
Okay, and the question about the slight uptick that we're seeing, are the surrounding counties monitoring that? Yes. We have now a bi-weekly call of the leadership teams with the surrounding counties to talk about our mutual responses to managing the spread of the virus here within Central Florida. But there are also daily conversations that our emergency operations centers have between the state and here within the region. And so we're paying attention to it. And based upon what information we receive regarding the contact tracing that is done by the state and the Department of Health, we try to make adjustments in that regard. We also try to be responsive to complaints that we receive from citizens about locations where they believe businesses are not complying with the CDC guidelines. And so our compliance teams continue to go out, and that's why I share with you the data that we produce from that. Okay. Dr. Pino? No? Okay. All right.
Would not be the single panacea or the silver bullet that would help us take down cases in this pandemic. It's a layering of pandemic precautions. So it's part that social responsibility to not gather in large groups and to also practice the pandemic precautions in addition to the contact tracing and other non-pharmaceutical interventions.
This next question. Oh. Did you have a follow-up, Steve?
Yeah, no.
Okay. This next question was texted from Ryan Lynch with Orlando Business Journal for you, Mayor Demings. His question reads, where is the county at when it comes to its small business and home-based business grant programs? Does the county have a timeline for when it may close or wind down those programs?
Well, fortunately, we still do have dollars available to assist the small businesses with 100 or fewer employees or the home-based businesses. So that's ongoing. We do a daily and then a weekly assessment of where we are with the remaining dollars. So it will continue to remain open for a while.
And then this one comes in from Ryan Gillespie. I believe it's for our Department of Health team. His question reads, is this rise in cases tied to any specific outbreaks? Have you guys been able to tie that to an outbreak?
We have not. So the rise in cases is an overall, in multiple communities, an overall increase. And part of that has to do with people who are having private events. So there's been a lot of social events in small clusters. And so this has been reported in data from across the United States, is the rise in cases overall across the U.S. is tied to persons who are sort of relaxing up or letting up on the pandemic precautions, gathering in groups, whether they be, very large large or even small, which can be you are very close together and comfortable with, say, your own family members. And so we say the words birthday party a lot, and it's not just one birthday party, it's everybody's birthday party who are together, and you're comfortable, you're unmasked, you're not watching social distancing, and you're engaging in activities which might produce a lot of respiratory droplets, singing, hugging, kissing, shouting at televisions.
Thank you.
Sharon Stone, no questions today?
Have you heard, is there anything that you would say to people with this flu clinic coming up at a high school tomorrow? I was just sitting here thinking about the number of cases, and people might have concern that they are in schools, but then we're holding this flu clinic here tomorrow. Is there any cross concerns there?
Okay, that's a Department of Health.
So the school will not be open, and the event will be outdoors. So it's a drive-through. So roll in, roll up, and roll out. So it's a drive-through clinic.
I knew she had a question. All right, so if there are no other questions, then this will conclude the press event at this time. Thank you all for being here. We hope you have a safe weekend.